The most common question about home physiotherapy is a practical one. Do patients who receive physiotherapy at home actually get better at the same rate and to the same degree as patients who go to a clinic? The research answer is yes. And in specific patient populations and clinical contexts, the outcomes from home physiotherapy exceed those from clinic-based care. Let me walk through the evidence and explain where the clinical advantages of home physiotherapy are most clearly demonstrated. For post-surgical rehabilitation, knee replacements, hip replacements, ACL reconstructions, shoulder repairs, C-section recovery, the research comparing home physiotherapy to clinic-based care shows equivalent functional outcomes at 6 and 12 weeks. Where home physiotherapy consistently outperforms in the post-surgical research is adherence to the prescribed exercise program. Patients receiving rehabilitation in the environment where they live and function complete their home exercises more consistently than those who travel to clinic for their sessions. The reason is ecological. When a physiotherapist has observed your actual home environment, identified where you will do your exercises, and set up the space with you, the exercises feel naturally integrated into daily life rather than a separate clinical task. Post-surgical patients receiving home physiotherapy typically return to domestic functional independence earlier because rehabilitation occurs in the actual environment where that independence must be established. For older adults with musculoskeletal conditions, knee osteoarthritis, hip osteoarthritis, chronic lower back pain, home physiotherapy produces specific advantages that extend beyond equivalent outcome scores. Assessment and treatment in the actual home environment allows the physiotherapist to address the specific functional challenges that determine quality of life for that patient. Getting up from their particular chair, managing their specific staircase, using their kitchen in the way they actually use it. A physiotherapist who addresses functional impairments in the context where they occur produces outcomes that a clinic-based practitioner, working from a description of the home environment, cannot fully replicate. Quality of life measures, daily activity independence, and false risk reduction are all consistently better when older adult rehabilitation is delivered in the home. For chronic and complex conditions with significant contextual drivers, chronic pain amplified by work stress, postpartum conditions complicated by infant care demands, work-related musculoskeletal conditions, the home visit allows the physiotherapist to observe those contextual drivers directly. A workplace condition managed by a physiotherapist who has physically observed the workstation is more precisely treated than one managed from a clinical description alone. This produces a treatment plan calibrated to the actual functional environment rather than a generic clinical space. What outcomes should you realistically expect from a well-delivered home physiotherapy program? Pain reduction, as measured on validated scales, shows a 40 to 50% reduction over 8 to 12 weeks of active treatment for most acute and subacute musculoskeletal presentations. Functional capacity improvements are the more clinically meaningful measures. Increased walking tolerance, stair negotiation without pain, and return to specific household and recreational activities previously limited by the condition. Patient satisfaction rates in home physiotherapy populations are consistently above 85% in the published research, higher than the equivalent figure for clinic-based physiotherapy for comparable conditions. The satisfaction advantage reflects convenience, one-to-one attention, and rehabilitation targeted to real-world tasks rather than generic clinic exercises. Patients who practice in the same space where they need to use those movements in daily life report greater confidence in their recovery progress and higher functional independence at discharge. Return to prior activity level, including sport, recreational activity, and work tasks, is achievable for the large majority of patients with musculoskeletal presentations managed through home physiotherapy. The realistic timeline for meaningful improvement is 4 to 8 weeks for most acute and subacute conditions, with chronic and complex presentations typically requiring 12 to 24 weeks for full rehabilitation. Whatever your location in Malaysia, a first home physiotherapy session can typically be arranged within 2 to 5 working days. The link in the description has everything you need to arrange a first home physiotherapy session in Malaysia.